Okay, now this is going to be a very interesting panel, and I do want to tell quick stories about each of them because they all have a fascinating story. And the ostensible topic here is public health, but as you can see from our last panel, it goes all over the place. That's the way it should be. But first of all, we have Kulvinder Kaur Gill, who's visiting us from Toronto, and I'm so glad you're here. She is practicing pediatrician.
And allergy immunology practice.
Okay, yeah, and spoke out against the COVID lockdowns and then the shot mandates and that sort of thing, and ran afoul of the powers that be in our northern neighbor, and found herself under fire from well, her license taken away, and then subject to outrageous litigation, and then threatened with fines that would have required her to sell her home, and she and her children would have been homeless. And we had been working to help you for a long time, but that day I was walking in the park and my phone lit up and was you, and you told me about what was about to happen in 5 days, right? Mm-hmm. And so the Brownstone community quickly flew into action, and within 4 days, we had raised from many different people on a Give, Send, Go campaign, $200,000, just like that, right? We take care of our own, right? That's what we have to do. We have to do this. And then because of all that frenzied activity and so many people retweeting all this information, it got Elon Musk's attention, and he put his legal team on it, and then he took care of the rest, and he's been so. But you see what I mean when I talk about the need for sanctuary. I mean, this is the most urgent need we have to save our own people, our heroes, the dissidents, the people who are speaking out and making just good sense in senseless times. They need our help, and without it, lots of people are going to suffer anyway, but we can save some. So that's a great success story, and I'm really thrilled to have her here. Steve Templeton's book called Fear of a Microbial Planet. If you don't have it, please get it. This is the book that I wished had existed in 2020, when the whole planet Earth became suddenly pathologically germophobic. There's a terrible pathogen I have to stay away from. It's the only way to stay healthy. Within the economics community, economics, the field of economics is funny. They mask the absurdities with complicated language. Oh, that's academia, sorry. And all my libertarian economist friends said, well, you don't understand. You know, a germ, a virus, is a negative externality. And the whole purpose of government is to protect us from negative externalities. Therefore, the lockdowns are entirely justified. That's weird. That's a weird way to think. Well, what you discover when you read Steve Templeton's masterpiece is that actually exposure is a positive externality. So put that in your pipe and smoke it, economist. Anyway, the book is brilliant, and it's brilliantly written, and written with great care, which is unusual for nonfiction these days. Great attention to the prose. It's a real adventure. Great hero, professor of public health at Illinois, I believe.
Indiana.
My name's Iowa, Illinois. I get confused. I'm from Texas. I live in New England now. I don't know anything about the states. My apologies.
It's an I state.
Yeah, okay. If you don't have the book, please get it. He's here to autograph it for you. It's a book for the ages. It didn't exist in March 20, but he wrote it carefully over the next year. Brownstone published it. It's one of my proudest achievements. Brownstone's proudest achievement. I, too, am a servant of this great institution. And then finally, we have Scott Jensen here, who is a fascinating figure about whom I should have known back in 2020, but I didn't know about you at all and your experience in. I'm going to say the name of the state wrong. This was Minnesota. Is that
Minnesota.
Minnesota? Yeah, Minnesota. My knowledge of American states is lacking. Minnesota, and I wondered in 2020. Well, so, this is what I thought. I thought after the lockdowns happened, about 10 days later, there'd be a mass uprising, and everybody would be out with pitchforks, and the elites would say, "Oh, sorry, that was regrettable," and we'd go on with life. Well, that didn't happen. And I thought the election of 2020 was all going to be about all lockdowns, but the subject hardly came up at all, right? Remember that? Well, it turned out that there were some people that were trying to make it an issue, and Dr. Jensen's one of the top guys in the country who is running on these issues of bad public health practices in 2020. I'd never heard of it. Guess what? Zuckerberg deleted his account from Facebook, and the campaign couldn't get any traction on social media at all. Well, it turns out he only lost by 7 points, which was remarkable given the extreme censorship you confronted. And the guy who won the election is, his name is Tim Walz. Is that right? Yeah. Who now is asking for our votes to be our overlord. So there we go. And so he's here with us today. So I welcome our panelists, and I'm not sure where to begin this discussion. But actually, I would be very interested in any insights that you drew from your experience in that election. I'm guessing you were drafted into that role of running. Is that right?
Thank you all for being here. I asked my wife this morning, what circumstances brought us to Pittsburgh? If someone had told me 5 years ago what my life would look like, I think I would have moved to Zimbabwe, Africa, quite a while ago. But it was in 2020 that I was in the Senate in Minnesota, and I was vice chair of the Health and Human Services Committee. And I received a document from the Minnesota Department of Health and the CDC indicating that the way physicians were to complete death certificates was being modified. And that if a condition was potentially contributing to someone's death, we should put that in the contributing condition box unless it was COVID. If it was COVID, put it as a cause of death. Well, that made no sense to me, because if I have a patient that's dying of colon cancer and is on hospice, and in the last 48 hours of their lives, they've already said their goodbyes, but they happen to be exposed to COVID, and in the last 12 hours of life, they have a cough, I am not going to put that down as COVID. But at the same time, the government was creating perks and tantalizing incentives to put COVID. If you could hit 161 admissions to a hospital with COVID between January and June of 2020, you were then eligible to receive approximately $75,000 per patient on top of what you'd already been paid.
This sounds like a scene from the movie Margin Call, where the financial firm offers incentives for the number of sales that they conduct before noon and that sort of thing. Yeah.
And the thing is, they didn't tell anybody the rules. So the smaller systems in Minnesota, of which we have many small hospital systems, they didn't know that if they could ramp up their numbers and put COVID-19 on a lot of discharge summaries, because there are lots of patients that have 2 of the 3 criteria for COVID: fever, cough, shortness of breath. Well, if you're in a hospital 2 days, you're going to have a temp of 99.2 at some point, and you're going to clear your throat at least once. So you now got cough and fever, go for it. So I think in that year, my life turned upside down, because all of a sudden I was seen as some sort of radical, reckless whistleblower. And I went from being the family physician of the year in Minnesota in 2016 to the most investigated physician in Minnesota by the time 2022 rolled around. So I was recruited to run to be governor, and I ran against Tim Walz. And I was the last person to debate him prior to J.D. Vance having a debate earlier about a month ago. So for about 2 weeks, 6 weeks ago, I was being constantly badgered by the major networks. Would I please give some tips about Tim Walz? And I said, well, he's sort of like Teflon, nothing sticks. He's not going to talk about the issues because it doesn't do so well there. He likes a friendly media. He's not going to give you beliefs based on a deep-seated set of convictions because he's more zeitgeist in the moment. He's going to check which way the wind's blowing, and that's where he's going, and he's very good at it. And he's affable, and when you ask him a pointed question, he'll give you a word salad, and when he's done, you'll nod your head. But then if you ask yourself, what do you really say? You won't be able to come up with anything said. So that was my experience with Tim Walz. It did put me again in the limelight. But the real lesson that I learned from COVID was going back on your conversation, Jeffrey, with Matthias and Aaron a few minutes ago. I think that we became tribal as people, especially because public health was making it okay to become tribal. Matthias talked about rational thought. Well, rational thought sort of gives the notion that we can know something. Skepticism sort of says we can't know something. So as a physician, I try to constantly tell my patients, be skeptical of your physician. Be skeptical of your public departments of health, because so much of what they're saying that they can know, they can't know. Yeah. Science is not ever settled. It's constantly being viewed, measured, hypothesized, and then the hypotheses being checked. If there's one thing we learned, I think, as a planet over the last 4 years, it's each and every one of us has the ability to be skeptical, and we have to absolutely grow that. We have to feed that. We may not ever know what true rational thought is, but we can know that it's good to be skeptical. And skepticism means at one level, nobody can overlord you and tell you that you're wrong because they have knowledge. Skepticism always says very little, if anything, can be certain. And I think some of the most intelligent analyses of what we went through over the last 4 years, for me as a physician and as a senator and a governor's candidate, was that you didn't need to have letters behind your name in order to provide true insight into what we were going through. Yeah. That's what I thought.
Dr. Jensen, I have a question that I've never gotten a clear answer to. But in the early days, and it happened very quickly, every hospital in the country shut down for non-emergency services or non-COVID things, right? And that was true for dentistry and all medical services, which I didn't believe was happening until my brother called me and he said, have you heard about this whole pandemic thing? And I said, yeah, I've heard about it. I said, but how do you account for the fact that I work across the street from a hospital? The entire thing is empty. There's not a single car in the parking lot. And they're furloughing nurses. And I said, well, that can't possibly be true. And he said, well, I'm looking at it now. I'm telling you, there's nobody there. We're in the middle of a pandemic because nobody's sick or something. And so I looked it up, and sure enough, the nurses were. Anyway, my question is, I don't think we still have an answer yet. And by the way, I don't mean to exclude you, Kulvinder and Steve. You can jump in anytime. I don't think we have an answer yet as to precisely how that came to be. That even when there wasn't community spread, where nothing, that in one fell swoop, all the hospitals ended up, apparently it wasn't just in the US, but it was in many places in the world, were shut down for all diagnostics and all elective surgeries and everything. Who gave that order and why?
Well, I think we saw it from our government. I think we thought we know the puppets. We know that oftentimes your politically elected leaders are puppets. And then we know, well, who's the puppeteer? Who's the master puppeteer? And frequently we think we know them. Perhaps that's the unelected fourth branch of government. It's the staff and that. But what we fail to ask ourselves is, who's Geppetto? Who designed and created the puppet? Because that's where the real power lies. Is that the people at Davos or whatever? But this message started to come on down. And we saw it on newscaster after newscast. We'd see in a 4-hour period of time on a Wednesday, everybody using 6 out of the 7 same words. The message had gotten out. Someone had said, we're going to promulgate this message by George, and nobody's going to get in our way. And we did shut down our hospitals. We interrupted chemotherapy regimens. We interrupted workups. We told patients, we don't care if it looks like you might have pancreatic cancer, you're not coming in. And people died. And so now we're left to sort of sort it out. And I think one of the most important things we have to look at is we have got to look at cause of death. We have to look at all-cause mortality from one year to the next to the next. And in the US, this is critical. From 2015 to 2019, those 5 years, every year, our average pretty consistently was 2.8 million people died every year. In 2020, the pandemic hit, 3.4 million people died, not 2.8. So we went up 600,000. How many of those were people who had their treatment programs interrupted or didn't get evaluated? So then the vaccine hit in 2021, late December of 2020. That should have taken care of it, right? So we should see that 3.4 million go back down to 2.8, right? It didn't. It went up even higher. So we stayed at 3.4 million. Okay, well, by certain 2023, we should see it dropping, right? Because now we've had the vaccine around 2 years. It didn't. We still at 3.3 to 3.5. All-cause mortality gives us almost all the information we need. The vaccine failed. We killed people because we gave them a public health message that said, stay away, you're not entitled to health care until we decide you're entitled.
I think what's
Yeah. All right, Steve, you want to comment on that?
yeah, I think what's really fascinating is, I mean, because there's a lot of talk about what comes from the top down, but I'm really interested in the bottom up. You know, what made people agree to this? And you know, it's not just fear. I mean, you can just say people were afraid, and that's obviously true. And you can go back to the top and say, well, if we had better leaders, things would be better. That's not wrong either. But it's really fascinating to think about why did people accept this? Why did they turn on their neighbors and hurt their family and agree to do things like not be with a dying loved one in their last moments? I mean, those are human rights violations, right? I mean, those are things that in a normal world that we would never settle for. But I really think that there's this fear of uncertainty that has pervaded kind of our Western societies, because it's not just in the United States, I think it's in Canada as well, where people want certainty. And even if it's not true, even if there's a promise of it, and it's an appearance of, they'll trade safety and security for freedom. And I think that's a very troubling thing. And I think, you know, I hope we can end this on a positive note, because I think Matthias and Aaron did a good job of doing that. But you know, while we're airing our grievances, I think, to me, that's one huge factor. I can think of a story where during the pandemic, so in my book, I use my sister as a prime example of a germaphobe. And she's a good sport about it, and can laugh about it now, although she says she's reformed. I used her as an example, and I sent her a video of Anders Tegnell. And I believe this was an Unheard. It was probably Freddie Sayers, who did a lot of really good interviews during the pandemic. And I was very comforted by Anders Tegnell because he was very humble, and he was very willing to say, we don't know, when asked a question that he did not know the answer to, or he didn't believe anyone knew the answer to. And I was very comforted by that. My sister, on the other hand, was very frightened by it. She said, he keeps saying, we don't know. And I don't like that. And it made me realize this is one of the things driving this. People want the certainty. They want the experts to tell them what to do. And it doesn't matter if it ends up proving to be false. That is what drove a lot of this during the pandemic.
You know, I'm so glad you brought this up, and it reminds me of something you saw the other day, that this guy Obama, was president for for some period of time, said that he had left the Trump administration a playbook. Well, I looked that thing up, and it's the most convoluted thing. It's not a playbook at all. It's just a bureaucratic mess. I mean, it's 86 pages of nonsense. But one of the things that's in there is a color-coded chart. If the virus is the following thing: mild and regular, then you don't need to do anything. If it's severe, then you should do these things. If it's really really awful, then you should do these other things, and so on. You have this color-coded thing, but the whole thing is presuming that in real time the severity of the pathogen that's extant. Which my understanding is that that is knowledge you can't actually have before you experience it. So isn't there a fallacy at the root of all these plans? This perfect knowledge?
Nothing in science is perfect. And similar to the US, Canada also had a pre-prepared pandemic response plan following the SARS outbreak. And that was tossed out the window, similar to the WHO. If you look at both Canada's and WHO's pandemic response plan, lockdowns were never part of the scenario. And yet, lockdowns became the policy, and questioning it was dangerous, which is what I'm accused of, and it's now into my 5th year. So my battle with the licensing body in Ontario is all over tweets that I did in August of 2020 opposing lockdowns. And I was ordered to be cautioned because, quote, lockdowns in China and South Korea provide evidence that they can and did work to slow the spread of COVID-19. And for the respondent to say otherwise is misleading, misinformed, and furthermore, irresponsible statement to make on social media during a pandemic. So as Dr. Jensen and Dr. Templeton have both stated, science is about inquiry. Science is about questioning. It's not about absolute authority. It's not about having the answers. It demands to be questioned. But yet throughout the pandemic, our political leaders have told us that we should trust them as the one singular source of truth, that they are the science. Everything they have said is anti-science, and yet they accuse their opponents of what they are actually doing. And questioning is science. Having hesitation, not having certainty, that is science. But that uncertainty was replaced by our politicians and bureaucrats with propaganda and with outright lies when they didn't have the information. They were not honest with the Canadian public, the American public, etc. But yet physicians were given an ultimatum that if we question government, if we question the policies that were being imposed, we were then being threatened with investigations and possibly reprisal and losing our license. But that is science, that is medicine. But if you have a society where you cannot question government, that's not a democratic society. And I think we have lost our Western ideals. And I think that both Canadians and Americans haven't yet come to terms with that. Because in Canada, we still have our bureaucrats writing up reports, tripling down on their failed policies as being a success, as that the lockdowns just should have happened sooner and they should have been harder, as opposed to looking at the amount of damage that they have done. And I've come from a place of my faith. So I'm a Sikh, so my faith teaches me to seek truth and to live in truth. And that is now at odds with what my profession wants me to do.
Right.
Which is why my battle has now gone into the 5th year, is because the Hippocratic Oath says to first do no harm. And I'm supposed to seek and live in truth, but I'm being told that if I don't obey the government and if I don't propagate and agree with what they're telling the public, then I'm dangerous. And so I think that we have lost many of the ideals that Western civilization were built upon. And I think it's going to take us decades to get back to the place where we were. And I wonder if we had those ideals to begin with, or if some of that was an illusion that we had.
It began to slip away at some uncertain point in the past. Now, all three of you are like many of our speakers. You took great professional risks to step out. You made yourself targets to say what was true. It was a deliberate decision that you couldn't stay silent. And I suspect, I'd be curious for all of you to tell this story. I don't think any of you really wanted this role in life. You just wanted to do what you do. But you suddenly found yourself out there. How often did you get calls from friends and colleagues who said, thank you for what you're doing. I'm too afraid. I can't afford to. I've got bills to pay. I'm grateful for what you're doing. Please, each of you speak to that. Go ahead.
Well, Jeffrey, thanks for asking that question. When I decided after I was finally cleared by the Minnesota Board of Medical Practice of 6 different investigations and 20 allegations being reckless, I had the audacity to say things like, if you mandate vaccines for 6 months old, you're going to have some downstream effects that you don't anticipate. You're going to undercut the confidence that our entire society has in all the vaccines.
Uh-huh.
You couldn't say that out loud. I did it in an affidavit, and that was one of the investigations against me. But I think 2 points. One is, you asked, how did we get to where we're at, where people bought into this charade? You mentioned in your keynote address that the intellectuals failed us.
Yeah.
And I think they did, because I think, and you also mentioned that there's 2 classes of people, I think, sort of the elites and the everyday people. I would stick a third one in. I think you have the elites. I think you have the everyday people who get up and were profoundly affected by the lockdowns, the lock-ins, the lockouts and all. But I think you have a group in between that are insulated. They were protected because they had the means to potentially homeschool. They had the means to do this.
Yeah.
They don't consider themselves elite. They don't consider themselves a part of that governing circle. But they sit there, and arguably, my wife and I could be that group. If XL, our power company, increases our electricity cost 5%, we may not like it, but we're insulated. But that everyday group of people is not. So I think if you look at it that way, our intellectuals were the ones who were supposed to be questioning the comments from someone like Fauci, who says, if you don't follow me, you're not following the science. Those intellectuals were absent.
Yeah.
They were absent from the conversation. So that allowed stupidity to rule, and it did.
Yeah.
Now, getting back to what happened to me and to each of us in terms of our colleagues, did they come to us and say, hey, thanks? No, they didn't. I remember colleagues would vilify me on TikTok and Twitter. And I remember reaching out to them because I knew some of them. And they were calling me all kinds of names. And I said, could we just have coffee? I mean, we can't be that far apart on this issue. And
6 feet.
crickets.
6 feet.
They had no interest in having. They had no interest in having a conversation. They just wanted to throw darts. Well, now it's changed, obviously, over the last 12 to 18 months. But what really changed my life was when I went on the offense. Once I was exonerated by the Board of Medical Practice, I made the decision to sue the Attorney General in Minnesota, and I made the decision. And I sued the Minnesota Board of Medical Practice. And when the Attorney General said that they were not going to participate in the Freedom of Information Act in Minnesota and provide us the documents we were entitled to see, we told them to go to hell, we're coming at you. And the judge ruled in our favor. So they did have to turn over documents they didn't want us to see. And some of those documents, just exactly what you said, Kulvinder, sometimes all it took to file a complaint against me was just to take a screenshot of a tweet, send it to the Board of Medical Practice, say, see, this guy's a crackpot, take away his license. So we're suing the Minnesota Board of Medical Practice for interfering with my freedom of speech. Yes, the Board of Medical Practice does have jurisdiction over my professional conduct as to how I take care of patients. But I had 20 complaints, 6 investigations, and not one of them ever came from a patient of mine. So when it comes to the world of political speech, if I'm on the Senate floor or I'm campaigning to be governor, I get to express my opinion. And my opinion is that you shouldn't be mandated to take a vaccine. That's not medical advice that the Board of Medical Practice can threaten me in terms of taking over my license.
Yeah.
And that's what they did.
Yeah. What about you, Steve? You faced a lot of personal issues. I mean, from your church, from your school, everything.
Yeah, well, I mean, there's a lot of people probably in this room that have those personal stories where they lost friendships, they lost their community. I didn't have any way near the public persecution that these 2 colleagues have had. But I have a lot of, personal stories that fit the mold. I mean, my boss did get a few phone calls, irate, like, what is he doing? What does he think that he's getting involved in? I wrote some articles first for the local newspaper, just trying to be the person. I mean, they had originally come to me at the very beginning, like, okay, we want to know what the local scientist, local immunologist knows about this or wants people to know about it. And I said, don't panic. And then the very last sentence of my interview, I said something to the effect of, I don't think the lockdowns are going to work very well. And they actually put that in back then, like very early on. That was
What date
acceptable.
would this been late March about?
Yeah, it was right when things were starting to shut down. All of the,
Mid-March.
yeah, all
Yeah.
the sports, all of the, just everything was really just starting to, inside a week. And just coming from, not a strong public health background, but as an immunologist and understanding basic epidemiology, I could understand that you can't suppress this and without a serious consequence. And I was, of course, accused of being, sort of denying the infectious disease, theory of infectious disease, basically, and that you should be able to hide and not get infected, right? That makes sense. If you never see someone else, they can't give you an infection. But I was thinking bigger than that right away, and that sort of spitballed into some larger efforts. Eventually, I became part of the public. I started to write nationally. Jeffrey noticed me, and I would get a lot of feedback from even people at my own university saying, "Thank you for doing this. We don't feel like we can do this. We're glad that you are." Um, which my response was, "Thank you very much, but you know that you can speak up." In fact, if even 1% of our population had done that, I think things would have been very different. And I think if it does happen again, there will be a larger group of people that say, no, this is enough. We're not going to go that same route. And I know that that's an international thing too. I mean, I was in the United Kingdom in the month of June, and I would talk to a physician, and they would say, oh, if we had this, we would do this again. We would have a lockdown again. Then I talked to a cab driver. He's like, "No way. We're never
No way.
doing this. We're never doing this again."
I'm of two
And so
minds about that.
that is from, the elite class and the
I'm not convinced.
collar class.
I'm not convinced that there would be enough pushback against enough.
Yeah, she says she's not convinced that we would get enough pushback. Yeah,
Yeah.
I agree with
Oh,
you.
the reason I'm not convinced is because there has been no truth and reconciliation. And until the day there is truth and reconciliation and there's acknowledgement of error and there is some form of apology
Yeah.
for all the inhumanity and the dehumanization that was imposed by the people who held the utmost positions of trust and authority, I don't think we will be in a better place. Like as Dr. Templeton had said, we lost our humanity during COVID, and the people who imposed that loss of humanity were imposing their inhumanity upon our humanity as though they were coming from a moral good. And I found that the most heart-wrenching things that happened in Canada was that we forced people to die alone. We forced palliative care patients and the elderly to die alone. It's similar to what Dr. Jensen had said in Ontario. Essential medical care was labeled non-essential. Cancer care was shut down. Chemotherapy was shut down. Cancer surgeries were shut down. Surveillance was shut down. Diagnostics was shut down, all in the name of COVID. And in that myopic space, everything else was permitted. All the other deaths were considered to be noble deaths in the name of COVID. And I still can't grapple with that.
Right.
And I wonder if the people that are still going on with the persecution can't grapple with it either. And perhaps that's why they are tripling down, because to understand and to come to grips with the evil that they were involved in imposing, I think is very difficult.
So a number of comments about that. One is that it's remarkable that your experience in Canada was almost identical to the US. I mean, we like to imagine we live in nation states where the people elect representatives and all that stuff. It turns out we had a global policy. Brownstone held a retreat in Spain where we had about 40 scholars from all over Europe. All the experiences were the same. We could talk about this without any really notable national differences in any policies all over the planet Earth. And even crazier, what you said earlier, Steve, what you told the newspapers on, say, March 16th, those exact words, don't panic, don't worry, we're going to get through this like we always do. It's a normal respiratory infection with a zoonotic reservoir. It's going to spread, and we'll develop immunity to it. That was exactly what you could have read a month earlier in any mainstream publication, including the New York Times and Psychology Today. Everybody agreed with that until suddenly it wasn't allowed to say those things. So that is a crazy world. That's the world we're describing here. And it's still, I've yet to fully process, what that meant. And we talked about what's going to happen next time. And like you say, Kulvinder, where is the coming to terms with what happened? It's almost non-existent.
No.
Outside of Brownstone circles, there's almost no talk about it at all.
Yeah, I actually agree with Aaron Cariotti, what he said. This could take a generation. That's for the elites, though, I think. I mean, I think the blue collar folks are a little more aware of what happened, and they lived it. They had to deliver the groceries. They had to be forced to get vaccinated to save their jobs, and so I think it's the elites that need to come around.
Yeah, so
And it could be a generation for that, because so many people were complicit. It just you're not going to have a mass apology.
The very people who were thrown in front of the virus to protect the elites were themselves forced to get vaccinated later, even though they were the ones most likely with a natural immunity. So there you go. Right? Yes.
Jeffrey, I think so many people are hoping that somehow we can inoculate ourselves against this happening again. I think that's what we're looking for. And I think the question has to be, how do we get to that point where we are inoculated and it wouldn't happen again? I think some people think that if we can get everybody to say, I'm sorry for being wrong, that might do it. But it won't. I think we have to sort out that everybody was entitled to their own opinion. Some people were right on these things and wrong on these things, and other people might have been wrong on almost everything, and other people might have been right on almost everything. But to your point earlier today, Jeffrey, and what you said, Colin, somehow we need to elevate that notion that science is never settled and that the intellectuals failed us when we needed them most. And if we can raise up the voice of that taxi cab driver, Steve, that said, no, it's not going to happen again. Because what we really have right now is we have COVID-19 and its policies versus, in the United States anyway, the Constitution. So we have the Constitution and the Bill of Rights supposedly saying this, and we have these COVID controllers saying we can kick that aside whenever we need to. And somehow we have to raise up as a people of the planet and say, no, we will not let it happen again. To me, that's the only inoculation we can get. There is no easy way.
I think in Canada, the court systems really failed us as well.
Well, they were closed.
And well, even when they were holding their Zoom hearings, the courts are supposed to keep the governments in check, and instead they were giving deference, blind deference, to government, and so there was no means of accountability for the average citizen in terms of what was being actually imposed upon them.
Yeah, that was a shock to me. I thought the courts were after March 8th, when they shut down South by Southwest in Texas. That was the very first lockdown in the U.S. I thought, oh, that's going to be 15 years of lawsuits. That's never going to fly in America. I had no idea what was coming. But the failure of the courts has been the great shock of my life. We'll give an advertisement here for Justice Gorsuch. He has a new book called Overruled, in which he has 2 chapters on the COVID experience and cites Brownstone extensively. So, yeah, so we've got there's a science of hope.
And actually, I was prepared to finish on that.
Yeah,
Just
go
that
ahead.
after we aired our grievances, we could talk a little bit about positivity and that there are signs of hope. I think some institutions are starting to show signs of it. And you're starting to see, and it goes to the whole, what people have been talking about, censorship and all these things that have been a legacy of pandemic response that are with us and will continue to be with us until we fight them um, back to where they belong in some corner somewhere. Um, but you see institutions, having statements of neutrality. You see some colleges, universities having neutrality statements. We're not going to take a position on this. Um, and some of it has to do with Israel Palestine and those kind of issues. But they've made that decision. And in my own state, there's a law now that we're supposed to promote intellectual diversity. Now it's kind of a clunky law that may not stand and could be abused in ways that laws can be abused. But the fact is that they try. This was an idea that the legislature put into law, was to promote intellectual diversity, and
That's a pretty radical notion for a university to.
right,
I don't know. I'm still
right,
grappling with it.
right. But even the fact that these things are happening, I mean, there's a new university, University of Austin, that I'm a huge fan of. That they said, if your institutions fail you, you create new ones, and I think that's happening. And even on a cultural level too, we have like the Babylon Bee. I mean, you might not think that's important, but um, humor is a huge cultural driver, and all these things that have happened have, in my opinion, been downstream of culture. I mean, we can throw out our leaders, we can get new leaders, and but the incentives that they have are downstream from the culture. And so I think these things are positive developments and uh, and give us hope for the future.
But to build on that, I think in the US, some of the leading academic institutions are really starting to help set the tone and to come to terms, sort of beginning to come to terms with what transpired. So
What's an
Dr.
example of that?
Bhattacharya's recent Stanford
Yeah.
conference, so that opened with the new president of Stanford actually setting the tone in terms of,
Did you go to that?
yes, I
Okay.
had attended.
Did you speak?
No, I didn't.
Okay.
And then a couple days ago, the Yale president put out a statement, as Dr. Templeton alluded to, about having a neutrality from institutions. And we're also seeing some changes in the political sphere as well. Last week, the Premier and Attorney General of the province of Alberta has announced that they will be introducing legislation to protect the freedom of speech of regulated professionals in their province. So things that have happened to me and some of my colleagues wouldn't happen in that province. So perhaps that's sort of a lightning rod, and maybe that will trickle down to the other provinces. That's something we'll have to see. But if there is no freedom of expression, then there really is no freedom of thought or opinion, or even freedom of conscience. And depending upon how you perceive the world, or what your worldview is from a spiritual or say like a religious standpoint, then if there's no freedom of expression, then there's no freedom of conscience.
Well, I tell you what, sometime in 2020, there was a lot of people thought they had it in the bag, and we were just a matter of time. We're gonna stay locked down to the vaccine. We're gonna have a global vaccine passport, and everything's followed from that. It didn't work. Their plans didn't work. Thank goodness for that. But a major reason is because of people like you three, who, when the history of our times is written, I know that all of you should be held in high esteem for the role that you've played, the courage you showed, for the power of your intellect, and for the persistence of your moral imagination to see what was right and refuse to tolerate evil in your presence. So I thank you for that. Let's thank our panelists.